Hi, I'm Dr. Adam Fields. If you can't put 3 fingers in your mouth like this, you may have lockjaw, or what's called trismus. So let's go ahead and work that out. Let's start with some knuckle dragging right on your masseter muscles. Take your knuckles right up here to this ridge here, and we're just gonna pull down. Push hard. I want you to hurt a little bit, right? Hurting in this instance is good. Now, with this, you can flare up a little bit from these exercises. Keep going. So you will want to be doing some heat. Do heat throughout the day. We want to heat this. Lockjaw loves heat. So heat it, heat it, heat it. You may have something more serious. You want to check it out. See if you have some dental problem, problem with your tonsils or whatnot. So check that out. And if it doesn't feel right, if I'm doing an exercise, it doesn't feel cool, get rid of it, bail on it, and do the next exercise. This video will be paired great with my TMJ 3 video, and keep going. Give it some pain, people. We love it. We love that pain. Embrace it. Pain is emotional. Pain is an emotion. Good, pushing it hard. Good, now we're gonna go now to the joint line. So open your mouth and come right up here, and I want you to open and feel the top of that bone, the condyle there. And we're gonna just go across the joint with your fingertips. So, and back and forth. Keep your mouth open and go back and forth on the top of the joint. You might have some pain in there. Work it, go back and forth. That's it. This can take some time. Have some patience. You're gonna do a couple of my videos a day. Okay, now we're gonna do some skin pinching right at the joint. So grab the skin and just pinch and pull. And circles, good, circles and pulling. Pulling, pulling, pulling. Good. Going right in that joint. Now come down a little bit and the same thing, pull it. This is working the superficial myofascia, the covering around your muscles. We want everything loose. We want this jaw to be able to open up, no problem. Keep pulling. Kind of a bizarre thing to do with your face, but it's very good. You'll find a little tenderness around that joint, and that's okay if you go into it. Okay, we're gonna open up, and we're gonna hold that for 10 seconds. So we're gonna open, good, now we're gonna come open and we're gonna go to my right, your left. So go ahead to your left, open and good. Now let's open and come over to the other side. And now we're gonna go again, open, and this time you're gonna use the tongue to push your jaw down. Woo! Got me there. Okay, go ahead. We're gonna open again with the tongue, and then we're gonna go to your left, my right. Open. Perfect. Now you just feel some warmth. You're gonna feel some warmth in that joint. So go ahead, open again with the tongue, and we're going to your right. Very good. And let's just massage that a little bit. Oh, you're being good to yourself today, aren't you? Wonderful. Let's make a habit of it. Okay, now get the web of your hand. We're gonna do passive opening now. We did active, now we're gonna do passive. Get it below your chin, and let's bring that chin down and pull like this. Get the other one over it, and we're gonna keep our hands where they are, and we're gonna lift that head, pulling the jaw open. Here we go. Really open it up. Go for it. Just let it unhinge in a way. Okay, beautiful. I just start to just feel some blood going in there, opening it up a little bit. So we're gonna do a chin tuck, which is where we go like this. We're gonna hold that chin tuck. Let's hold it. The hands are gonna be, palms are gonna be facing me, facing forward. And then we're gonna do some opening of the mouth, holding it for 5 seconds, okay? So the chin tuck and then open the mouth. Let it relax. Now open again, keeping that chin tuck, keeping the head back over your shoulders and go open. Good, let it relax for a second, but keep that chin tuck back and open the jaw. You're gonna find this is a little challenging. And again, here we go, relax. Big breath in, and as you breathe out, open the jaw. Good. Keep that chin tuck, big breath in. Open the jaw. Good. Okay, let it relax. Oof, here we go. So let's do a little neck stretches here. So you're gonna take your hand, we're gonna pull it 45 degrees and just tuck that chin. We're attempting to stretch right up here, right at that C2, C3 area, the upper cervical area. The C2, C3 is where your nerves exit and go to your muscles of mastication. So if you have, if you're clenching, if you have what's called bruxism, this could help. Actually, the whole combination could help. And just pull and tuck and take a big breath in right into that. Just inhale right into your neck. And as you breathe out, just pull that jaw even more. Doing wonderful. Let's go to the other side. Big breath in and pull. The opposite hand, the palm is facing me. You know, it's interesting, the psychological aspect of like clenching of the jaw is so profound. So I always tell people, if you have anything bad with anyone, if you need to forgive anyone, just let them go, pay the debt. Even the person's not around anymore, just let it go, forgive them. Forgive yourself even. You gotta forgive yourself. Otherwise, that subconscious thoughts just swirl around into these muscles of mastication. You end up clenching too much. And if you're working too hard, take a Sabbath. Take 1 day a week where you just put that phone down, put that computer down. You just go look at the clouds, hang out with people that you love, and just feel a relaxed vibe. It's going to help your jaw. So we're gonna take both hands and we're just gonna pull. And breathe right into that upper thoracic spine. Good, let's go into, we're gonna protrusion, we're gonna go with protrusion and retrusion. So pushing the jaw forward and back. Forward and back. Protrude and retrude. Protrude and retrude. Here we go, protrude. Looks kind of silly, but we can do it. And bringing it back. You are fabulous. Keep it up. Okay, now we're gonna do the same thing with the open mouth and the chin tucks, except this time we're gonna go radical open mouth and then we go into the chin tuck. So open mouth with the tongue curled forward, like this, pushing the lower teeth down. And now with that open, we're gonna go into the chin tuck. So so fun, right? All right, so now let's get the knuckles. We're gonna work your temporalis muscle. We're just gonna go up like this. Up, 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 up. Oh, into that skull. I know it's tight on you. I know it. Just keep going. I'll often do even extracorporeal shockwave therapy on the masseter muscles and even in the TMJ. Especially you get an MRI, there's a little degeneration in there. We'll go right into the joint and literally get some angiogenesis, regeneration, that type of thing. Keep it up. And pushing up. Oh, this feels so good. I think we all need a scalp massage occasionally, don't you? I'm so glad you're taking care of you today. I am just, when I see comments of just you guys and your success, my heart is just overjoyed. I've literally shed tears over comments about the videos because people have been suffering for so long and then they just go through my TMJ videos and, oh, I'm getting relief. Or people that can't afford care and they're in Timbuktu and now they're able to find something, you know, get a foothold to climb that Everest of helping their TMJ. And other people, it's just, woke up with jaw pain and got some help. So keep it up, do 2 of my videos a day, and get your healing.